Okay, we're gonna to start our training session. So we're going to start. First, we're going to introduce Mr. Xu Feng. Now we're going to start our session. Now, for today's session, we are quite honored to have met Mr. Xu Feng for sharing. Mr. Xu is the Director of an International Cooperation and Exchange Office, and also a member of an International Exchange and Technical Cooperation Committee of the Beijing Integrative Medicine Society. Also, the executive director of the Chinese Medicine Cultural Professional Committee of the World Federation of Chinese Medicine Societies. In 2017, he was selected as one of the first batch of outstanding talents in traditional Chinese medicine by State Administration of Traditional Chinese Medicine. Professor Xu has long been engaged in research on the history of Chinese medicine, the international exchange of Chinese medicine, international communication, and the popularization of Chinese medicine culture and promotion, and has published more than 10 academic papers in related fields such as the international construction of a Chinese medicine hospital, Chinese medicine culture going out, Chinese medicine education, has published 2 professional books, participated presided over more than 10 projects at all levels. Today, we are quite honored to have Mr. Xu Feng to share with us about his experience in this area. Thank you, host, for your introduction.
I'm sorry, I didn't quite catch that. Could you please say that again?
And also, we'd like to thank our host
I don't know what you mean by it. And I was the one that you said come away.
And also, I have been practicing in this area. And then in 2020, because of some reasons, and we transferred from offline meetings to online meetings. And I thought it would for the short term, but now we know that it has been long term. And we would like to know what is the reason behind it. It is because the COVID-19 has been for the long term, and then it is not about the medical, it is also about our daily life. Speaking of COVID-19, probably we will think of those negative words like the lockdown of the hospitals and the schools and the factories. But we have to know it is mutual. But because of such a situation, we focus on more the health, the epidemic, and related knowledges. And also, we have keep informed of more information in this regard. And because of such a common topic, we are here to listen to my lecture, though not every one of you are in the medical industry. As you could see, such COVID-19 has been in our daily life for a long time. It is going to be so for the long term. For sure, different people will have different feelings, but we have to accept the fact that they are going to be with us for the long term. So, though today I'm going to share about the current and the future, it is going to have the of great importance for our future work. And for sure, for the epidemic, we have some fears. It is because it is unknown. Now I'm going to share with you about my practice in the treatment of the COVID-19. Probably you could only remember some of what I have shared. Still, you're going to know better how to prevent yourself getting the epidemic and know how to treat the disease after being infected. So you're going to find this information gonna to help you well fit into the post-pandemic situation. As actually many countries have been well prepared for the situation that the pandemic are going to be with us for the long term. That is why today's sharing is quite important. Now I'm going to share my slide. So today, in the course of my sharing, if you have any questions, you're welcome to say your question in between. As for your questions, I will try to answer as much as I can, though I cannot answer all the questions, but I will try my best. And also, you could type your question into the chat box, and I'm going to answer in between. As I said before, for the COVID-19, it is not only about the medical area, it covers many areas. And here also, different areas have taken different kinds of measures. Here, I would like to introduce about the COVID-19 prevention and treatment and their features. And now we have the integrative medicine. That is to integrate traditional Chinese medicine and the Western medicine for the treatment and prevention. And here you could see from this slide, you're going to know better about our achievement. And then probably you have heard from the host about our background. And here now I would like to first introduce about the Xiyuan Hospital. It was founded in 1955 based in Beijing. It is a large integrated AAA grade TCM hospital that integrates medical services with scientific research, education, and healthcare comprehensively. And it has become one of the important window of a medical exchange with foreign countries since the open and rapport of China. It is one of the traditional medicine cooperation center of the World Health Organization. In the past 35 years, it has received visits and exchanges from more than 1,000 groups from nearly 100 countries and regions around the world. And speaking of the COVID-19, and we have done several work. There are two first. We know the epidemic broke out first in Wuhan, our Hubei province. Under the guidance of the Ministry of Health, the first national TCM medical team sent to Wuhan, Hebei of China. This first team was from our hospital. Later, we have the epidemic under control, and then other countries suffered from the first wave of the epidemic. And for China, we helped other countries and donate the resources. And also, we sent out our medical and expert teams to foreign countries for the short and long term help. And still, it was our hospital that sent the first national TCM medical team to foreign countries for help. Since January of 2020, I worked in Cambodia for 1.5 years. I could see our participants from Cambodia for this meeting, and also now I'm also working on Hano Pan. Actually, not only to this pandemic, in the previous epidemic outbreaks, our hospital has always been supportive and helpful in the fight against such pandemic. So it requires the multilateral cooperation for the success in the fight against the COVID-19. That is why China has been quite active sharing related figures with the WHO for better treatment of the epidemic. And also, we have been promoting the academic sharing and signing out the medical teams. Since the founding of our hospital, and we have been actively working with other hospitals, education institutes, and R&D institutes, working on those bottleneck problems, and we have achieved a lot. Now I'm going to move on to 3 parts about my sharing. The first one is to share with you about the rich experience in combating epidemics for the TCM. Today is about the epidemic. It broke out around the end of 2021 and then beginning of 2020, end of 2020 and the beginning of 2021. We cannot see it as a single incident. We have to put into the long history of the human beings. Because if we take a look at the whole history, we are going to find something in common. As the population increases, we face 3 threats. First, epidemic because of the virus. Number 2, natural disaster. Number 3, war. And among the 3, the epidemic has the largest scale of impact. It is common in all different countries. And we know we have the Black Death in Europe. Now, today we're going to focus on China. And also, I'm going to share with you about the background. As you could see, the breakdown by the dynasties. You could see the times of the epidemic in different dynasty. If we add them together, we will find that in the history of China, we have over 300 times of the epidemic. It happened every 6 to 8 years. In the past, now it happens about every 2 to 3 years. Because it is so frequent, can we say we are doing a quite good job in dealing with that? I think we have done a quite good job. Even we haven't done well, we couldn't have enjoyed a better life. And also now we could not have this meeting. And in the combating, and different countries have accumulated lots of experience, and those are included into the classic of the medicine. To the right, you could see two photos. You could see the Chinese characters. Probably you do not know what do they mean, but you could see they are quite ancient. They are quite ancient indeed. The above was written in the East Dynasty, and the second one was written in Qing Dynasty. They are both quite ancient. But later I'm going to share more, and you're going to find that though they are time-honored, enjoying a history of over 1,000, they are still quite effective in the treatment of those epidemics. You know that the epidemic has great impact on the world. Let's take a look at the infection cases. This is from the dashboard of Johns Hopkins by April of this year. And currently, we have 490 million people affected. It affected Southeast Asia, East Asia, Americas, North Americas, South Americas, and the Western Europe, shown at the right of this slide. So what can we do? First, vaccine. The COVID-19 vaccine actually haven't developed in the shortest period of time, but it has generated the largest scale of impact. And the darker the tone, the high level of the vaccination, and also the more serious the pandemic is, the higher level the vaccination is. We have another two figures. This is the population fully vaccinated in different countries. And here we could see for most of the vaccines, they have two jabs. So if we mean fully vaccinated, it means they already have two jabs. Here, America, China suffered most from the epidemic, but they also have the highest percentage of the full vaccination. America, UK, China, Russia, India are the main producers of the vaccines, and their vaccines cover most of the world. And also, China is increasing its coverage of its vaccine worldwide. Let's move on to the COVID-19. Probably you have forgot COVID-19 and related names. You only remember Omicron and then Delta, such names. Either for Omicron or Delta, actually, it is the variants on the seventh virus. And people are asking, will they have more mutations? Actually, we hope not. This is because you are not going to have the second chance infection. For example, you get the Omicron and you are cured, you're not going to get infected in the next round. Those are the general situation, but for some vulnerable people, they're still going to have a chance of being infected twice. But unfortunately, the virus is going to have the mutation continuously because virus could not live in the world forever. So they have to have the mutation in order to survive. But we're going to see the decrease of the severe cases because virus actually doesn't want to kill the host, so they want to co-live with the host. That is the big trends. Now let's take a look at the role of TCM in the fight against COVID-19 and take a look at the figure of 2020. Now we're already 2022. Somebody will think, why should we take a look at the figure of 2020? It was because the epidemic broke out at the beginning of 2020, and all the countries in the world did not have the prevention and treatment policies and solutions. So different countries have a different tries, and so did China. And we try to treat the patients by the TCM. And then by the end of 2020, we find out TCM is helpful for the treatment of COVID-19 and its prevention according to the studies. And also, we could see the outbreak in Beijing, Shanghai, and other major cities. Though the epidemic is reoccurring, we haven't changed the policies. This is because the policies are made based on the studies by the end of 2020. So we would like to share with you about the data from this study. By the end of 2020, more than 91.5% of COVID-19 patients in China used the TCM, accounting for 91.5%. The second figure was 90.6%. Hubei, especially its Wuhan, received much attention from China. And then for the patients in Hubei, more than 60,000 people used the TCM, accounting for 90.6%. The third figure was 90%. The observation of clinical efficacy showed that the total effective rate of TCM was over 90%, and we could see the important role of the TCM from those three figures. Now I'm going to share from another perspective, and we know for the virus, we pay attention to it a lot because it is related to disease and the deaths. From the perspective of disease, we could divide our life into different stages. We used to only look at the age. If we look at the age, it is only about the young, middle age, and old. If we see from the perspective of the disease, it has been divided into three stages: prevention before illness, second, prevention the disease from getting worse, number three, prevention of a lapse after curement. So to be specific, it is about prevention, treatment, and rehabilitation. So that is why we could know better about the disease.
First, it is about prevention. And it should be dated back to the early of the disease when we firstly arrived in Wuhan. we faced a problem, and this need to be resolved quickly. And based on the policy of the risk control, a lot of people locked down in their homes, but many of them have coughs and some symptoms of getting a cold, and they hope to receive the treatment in the hospitals as soon as possible. But early of this disease, there were so many people in the hospital, so we could not provide the instant treatment. And due to the pandemic, such kind of anxiety has been spread among the whole population. And this is a question and problem we need to resolve at first. And at that time, we put up the plan, and we like to use the Chinese traditional medicine to intervene. And we think it is very important. When we firstly proposed this idea, there are a lot kind of traditional Chinese medicine being transported to the Wuhan city in Hubei province. After we gave such kind of TCM to these patients, their symptoms have been decreased, and they may feel safe to stay at home and also follow the risk control policy in that region. So this is how we prevent the illness. Now let's move on to the next one, which is the treatment. Actually, we have identified these patients into two kinds. The first one is the patients with light symptoms. Second is the patients with some heavy symptoms. Some in the severe cases, they may die. And for these two kinds of people, we have a clear goals. We hope that after our treatment, we hope that we can control the symptoms of those who have the light symptoms, and also for the patients with a heavy symptoms, we hope to decrease the death rate. So this is actually the treatment goal for us, and let's see the results. And we have conducted research in Wuhan. When we use this Chinese herbal medicine, we found that the risk of death had been decreased by 87.7%. And this has indicated that the TCM is very important and plays a very important role in the treatment. A third stage is about the recovery. So for all these COVID patients, after they receive the treatment, they will go through the recovery stage, and they will like to receive certain recovery in the certain institutions. So firstly, their symptoms should be decreased, and what's more, we need to focus on whether they will get the COVID-19 again. And we can see that in many countries, not all the countries chose this measure. And we found that many of them patients, when they receive the treatment, they can just go back to their home or go back to their office directly. Actually, this can be different based on the different situations in different countries. But in China, actually, we have the recovery stage for these people. And it is found that the repositive rate of the Chinese medicine intervention group was about 2.77%. While the repositive rate of the non-intervention group was about 15.79%. So with such kind of data, we choose the first measure, which has the intervention of the Chinese medicine in the following process so as to decrease the repositive rate. So if we consider the COVID-19 as the task, we can achieve a consensus that TCM really plays a very important role in the battle against the COVID-19. Now let's move on to the second topic. which is about the role of TCM in this test, how it can really achieve such kind of results. So previously, as we have introduced the patients into two classifications. First one is the patients with light symptoms, and the second is with heavy symptoms. So when we talk about the treatment, actually we actually introduce the treatments in these two categories. So firstly, it is about the severe and critical cases. For this one, we would like to choose the combination treatments. We have to see that the COVID-19 will firstly harm your lung, firstly, and it is a very important organ to provide the oxygen. So when it has been harmed, then some oxygen proportion in our body will be decreased dramatically, and oxygen should be transported by the blood to different parts of our body. So there is a kind of important index, which is a proportion of this oxygen in the blood. So when it is lower than 70%, then our life will be threatened. So under such symptoms, if you experienced, for example, once you have received the COVID-19 treatment, or your family and the relatives have experienced such a thing, you may say that the patients, when they stay in the hospital, the doctors will give them and send out some oxygen and input some oxygen to them. And when it is severe enough, then we would like to provide ECMO for them. But we can see that there are a lot of patients who are elderly people. And for this kind of people, we would like to provide them with enough nutrition. So this has been illustrated in these three parts, which have displayed in this graph. You can see there are three blocks of the treatments. After reading these words, maybe you can feel that such kind of treatments may be similar to those that have been used in your country, especially for the severe and critical cases. I want to highlight that your feeling is the right feeling, because this kind of treatment, especially for the severe and critical cases, has been highly recommended by the WTO, which is a standard treatment recognized by the WTO, which means that the process and also the ways that different countries conducted are the same one. But there is a new problem. So for the severe and critical cases, if we take the similar or the same approach, why? The results are quite different, like the death rate and also the average days of the hospital. Why the Chinese results are better than other countries? It is because it is based on the situation that based on the basic treatment, we also use some traditional Chinese method intravenous. So based on their different symptoms, like maybe they have the fever or not, low fever or high fever, whether they have the cough, whether they have diarrhea. And we would like to keep an eye on their condition, physical and also psychological condition. And for different kinds of people, we may use different kinds of the traditional Chinese medicine intravenous. And for some elderly people, we also have some shenmai intravenous. So these are some kind of intravenous that I just mentioned previously, and I have listed their function, their ingredients, and also their basic illustration here. And I know that you're not the professional in this regard, so I just share such information with you. If you have interested, you can just have a look after the class. I would like to make a point. So for all this TCM, their propositions in other countries are quite different, because in some countries, the TCM may be part of the health protect or the food products, which means that in the certain countries, ordinary people can buy it through in the supermarkets or in the drugstore, and they can make their own decision to how to use it. But for the TCM intravenous that have introduced today, they are actually have been considered as a drugs in China. So if they are the drug in China, then they have to receive a lot of tests in the laboratories first to prove that it is very effective and also safe. In the next stage, it can actually receive some tests, especially the clinical test. And after this kind of clinical test, we can actually finally get the approval from the Chinese authority to make it into a new medicine, and it can be used by the patients after the prescription from the doctors. So for all the TCM products that have introduced today, you can definitely be assured that they're safe and also effective. And for this picture, you can see there are some intravenous and they are in a bottle in liquid form. And previously, I just talked about some critical and severe cases. And I said that COVID-19 has different influence in different stages. At first, our focus is more about the severe and also the critical cases. Why? Because only those severe and the critical cases may have the death cases. So if it could not lead to death of the people, then we will not focus too much attention on it. But it is because the death rate of it is quite high at first. That is why we put our focus on the critical and severe cases at the very beginning. But after 2 years have passed, we can see that among all these COVID-19 cases, the asymptomatic, mild and moderate cases take a large share. And I would like to introduce the treatment and also how we deal with such kind of cases. And we recommend these three kinds of categories to use the TCM volumes. Maybe you feel quite worried because what we face are the COVID-19 cases. So no matter whether it is heavy or light, it has some infection influence. So maybe you think that it is not safe enough to just use the TCM formulas. So if you want to know it better, we would like to give you an idea about the combination of the Chinese and also the TCM and non-TCM, why we would like to make such kind of decision. You can see that in many countries, the traditional medicine can cooperate with the modern medicine in a very effective way. And we can see that their cooperation is quite deep in some countries. For example, in one hospital, you can see there are some traditional medicine departments and also modern departments. When a patient needs the services from both departments, then the doctors from these two departments can provide the treatment for this patient at the same time. So these are the real cases that we can say in other countries besides China. But in China, we actually deepen such kind of cooperation model. And we think that we can make such kind of combination between the traditional and the modern medicine in a doctor. So when our doctor finish their degree, whether it is the undergraduate, postgraduate graduate and doctor degree, they need to spend a lot of time in learning some Western medicine knowledge as well as the Chinese medicine knowledge. So after such kind of systematic training and also learning, when they graduate, they definitely actually know all the basic information and the necessary information of the Chinese medicine and also Western medicine. So after their graduation, when they work, they need to follow the rules and also regulations. It is not only a kind of requirement, but also the protection for them. So under such kind of regulations and rules, it requires all the doctors have the right to give the prescriptions to the patients. So in terms of the choice of this medicine, actually it plays a very important role in the right of the prescription for these doctors. So we have three kinds of the TSM. The first one is we have three kinds of the medicine. The first one is the Western medicine. The second one is herbal medicine. Maybe you once noticed that we actually cooked a lot of plants and also herbs, and after that we would like to drink it as the medicine. So this is about herbal medicine. The third category is more a kind of a combination, because the ingredients is more about a Chinese medicine, but its formula is more about a Western style. So on that basis, actually our doctors can provide prescriptions for the Western medicine and for the Chinese pattern medicine. So for Chinese TCM doctors, they can give the prescriptions of not only the herbal ones, but also the Western medicine. So there is a kind of phenomenon that when the TCM doctors deal with the COVID-19 cases, firstly, they can answer the question. And for the traditional medicine and also the Western medicine, which one is more effective to these patients? They can answer this question. Second, as they enjoy the same legal position, they can definitely choose the most suitable medicine and also treatment based on the patient's conditions. And with such kind of process, we can make such kind of clinical decision that for the moderate, mild, and cases, and also the cases without any symptoms, they can definitely use the TCM completely. And for this kind of treatment, we can call it 3 formulas and 3 medicine. And I would like to give some illustration one by one. The first one is 清肺排毒 decoction. It is actually the first prescription issued by National Administration of Traditional Chinese Medicine to the whole society. You can see a picture that is quite familiar that I showed at the early of today's sharing, which has 2,000 years of history. So when this pandemic happens, we need to find some treatment experiences in TCM. So we just searched in this book firstly. And we choose 4 typical medicine. And after some combination and also the we made it into the 氢氟排毒 decoction. And this is actually the treatment that can be widely used by the people, by the patients with or without any symptoms. And after each TCM, I would like to provide you with some evidence of the decoction or some A/B test data. So why we would like to prepare such kind of slides? Even though you're not the professionals in the medicine industry, we still want to provide you with such kind of evidence, because in terms of the traditional medicine, or we can say that for some traditional culture or some traditional knowledge or experience, a lot of people may ask a question first, whether it is still effective nowadays. Second, whether it is scientific enough. So for the effectiveness, actually, we have abundant evidence for that, because the TCM has been tested for so many times along the whole journey, and we can have a lot of clinical experiments and also clinical cases. So we definitely we can be very confident in terms of this effectiveness. But in terms of the scientific, we should use the new system, the new language to identify and also to describe it. That is why we provide such kind of evidence of the decoction. For example, like its data or some A/B test. And I would like to skip this part. If you have any interest, you can just have a look at it after the class. And the second treatment is 化石败毒 formula. It is actually based on the prescription recommended by the National Diagnosis and Treatment Protocol, and is optimized by the medical team of the China Academy of Chinese Medicine Scientists in Jingyintan Hospital. And it is actually dated back to the treatise on pestilence that have so many years of history. I have to say that medical industry has under strict regulation and also the compliance in all of the countries, because it is about people's life. So there is a basic principle for us to, there is a kind of basic code that have been widely used. So if this medicine is from other country that had not been registered in its own country, then it could not be used. But 化石败毒 formula is actually an acceptance, because it has been registered in UAE countries. And these are some evidence of 化石败毒 formula. And I would like to add some points. As you can see that for this TCM, it is not only for some mild and moderate cases, it is also about the severe and critical cases, because at early of this COVID-19, all of our focus is on the severe and critical cases. It's about decreasing the death rate. That is why when we develop the 化石败毒 formula, our focus is still on the critical and severe cases. So once it has tested effective on the severe cases, then we begin to apply it on the moderate and mild cases. So as the COVID-19 is spreading around to the world, we can see that some medicines have become popular around the world. I believe that 莲花清瘟 capsule is one of them, which is a kind of Chinese medicine, but it's popular. If you want to know some Chinese overseas students, or you know some Chinese friends, you may be familiar with this 莲花清瘟 capsule, and they would like to take it with them all the time. But I have to say that it is not developed for this COVID-19. It can be dated back to the year of 2003 when we fight against the SARS. So after that, we made it into the TCM product, which is Lianhua Qingwen capsule that you see nowadays. As it has been tested in our clinical test, we use it to deal with the moderate and mild cases, and we found it is quite effective. And this capsule is suitable for those who have some fever. And next one is about the Jinhua Qinggan granules. Similar to the Lianhua Qingwen capsule, it is not developed only for this COVID-19, and its development can be dated back to the year of 2009 when we fight against the H1N1. It was developed at that time. So it is also suitable for patients with mild fever and severe headache, and we really get some inspirations from Wenbin Xiubian, which also enjoys a long history. And if you are cautious enough or careful enough, you may find there is a kind of formula which is ephedra, which is actually under the strict governance in many countries. And actually, the reason why it is under strict control is because in ephedra, there is a kind of ingredient like ephedrine. And you may worry that if you use the ephedra, whether it may lead to some addiction. Actually, please be assured, because the commonly used clinical quantity of ephedra will not cause side effects such as rapid heartbeat, increased blood pressure, and addiction. So based on our clinical tests, we found that there's no possibility like addiction. So when we talk about the TCM treating the moderate and mild cases, actually there are some advantages, and I would like to provide you with some data. According to the status of the WHO, about 6% to 10% of the patients with mild cases will become severe cases. And in 2021, in Wuhan, the hospitals in Wuhan, many receive some moderate cases, and we found that the overall conversion rate is quite low. As I have mentioned before, there is some kind of study and also research behind this TCM, and I would like to give you a detailed illustration. Actually, most of this study comes from China, but for this one, it is the first one that we conduct this research overseas in other countries. And there are about 251 mild cases and moderate cases. And the minimum age is 20 years old, and the maximum age is 58 years old. So average age is about 44.7 years old. And so when at the beginning of our experiment, we found that their symptoms are different, like cough, sore throat, and some of them have some other symptoms. And let's see the results. It started from the 2020.
And so we could see from this study, it is quite sufficient. And in this study, we had the treatment by the TCM. and the first milestone appeared at the first 12 days, and about 121 patients were discharged. Then on the 29th day, we had all the patients discharged. And also in the process, we find that it took minimum 4 days from positive to negative, and its median dates were 6. Here is a table. To the left, those were the symptoms of the patients first admitted. And we could take a look at their rating when admission and discharged at different symptoms. And you could see the difference was big. And also these symptoms have been greatly relieved. Here we have 2 figures. We should pay great attention. The first line, the fever. The second one is the vomiting. Why we focus on fever and vomiting? It was because when they were discharged, only for these 2, their percentage was 0 or almost 0. It indicates that such 2 symptoms have disappeared or basically disappeared. So for other symptoms, actually the patients still have some of the symptoms. That is why we focus on those 2 symptoms. It is because though those 2 symptoms had basically disappeared, other symptoms still just the patients already still have. So we have to have the follow-up survey to see if those symptoms will disappear. And probably some of the symptoms would be together with the patients for half a year. And also, we could see from the patients, though cured, they still have those palpitation, fatigue, headache. It is because they still have the fibrillation after the treatment. So they are going to have those follow-up symptoms, and also probably they are going to have some new disease. For some male babies, and they are going to suffer those testicle inflammation, and this is because of the COVID-19. So we don't think that such COVID-19 is just a serious cold. We have to pay attention to that. Now let's take a 10 minutes break. Then we're going to move on with our lecture. It fit the clinical observation in 2020. It meet the manifestation, so that is why this name was generated, but in short period of time. Actually, some of the patients do not have a much high fever, and they only have a cough, fatigue, and pain muscles and diarrhea, but the pneumonia symptoms were not that serious. So the quite common symptoms were not common anymore. So that is why in the second half of February, WHO renamed it. Naming actually is a quite serious thing, but it still could be on a change in a short period of time. It has been called the coronavirus disease. So we call it a kind of a disease caused by the COVID-19. So if such naming could be changed so fast, that it makes sense. People are confused about its transmission route. So we know the route is more important, and we have to stay away from the virus. So we're going to prevent it. Then you are going to be curious about the transmission route. Currently, such knowledge is updating forever, but mainly it is a respiratory transmission route. So mainly it has two routes of transmission, the respiratory droplet and a close contact. And then you must be quite clear about that. Probably you are not quite familiar with some of the details, for example. The droplets are emitted by the patients through the coughing, sneezing, or speaking. It contains a certain amount of virus. Actually, I had such a Q&A session for over 100 times. Then I asked the audience, do you know what is the scale or the distance of the transmission by the respiratory droplets? I know some people are told by their country they should keep their social distance at 1 meter or 2 meter or 5 meter. That is why their answer to my question is about 2 to 5 meters. But actually, when I give them the exact answer, they are still surprised because actually the distance could be as long as 40 meters. So for a confirmed case, he or she has no protection, and if this person coughs, he's gonna to infect a large number of people in a quite long distance. The second one is the close contact. And currently, different countries have different policies about close contact. And in China, it is quite clear that is for the confirmed cases and close contacts of those confirmed cases. We're going to have some protection measures and to make sure that they are not going to infect others, and then if necessary they are going to receive treatment. And also you have two ways to protect yourself from those two transmission routes. Though probably what I am going to introduce the three measures are cliche, they are still quite effective. The first one is wear mask to prevent yourself and other to protect yourself and others. Second, wash your hands. If you could see obvious dirt on your hand, you have to wash the hands. When you see your hands are quite clean and nothing visible dirt, you are not going to pay attention to that. It is because on a daily life we're going to wear clothes, and the two hands going to touch a lot of things, and probably we know that the skin is a natural protective shield. We don't think bacteria and a virus can directly go through the skin into our body. And but we still know that we have those mucous membrane that are going to get infected just easily, and then our hands are going to touch such a mucous membrane, then we're going to get infected. The third measure is the ventilation. If we could do a good job following these three measures, we are going to protect yourself and your families. That's all for my sharing today. I'm going to leave some time for the Q&A session to see if you have any questions. So, dear audience, do you have any questions? Do you have any questions, dear audience? If you have any questions, please send it to our chat box. Thank you, Dr. Shui. And we know Dr. Shui is in the Phnom Penh of Cambodia, And so we are quite honored to have Professor Shi to share with us the practice and the experience of their work. So we are quite honored to have Mr. Shi to share with us. And we would like to extend our gratitude for their contribution. So if you have any questions, please send it to the chat box. And this slide, you could see my contact information. So feel free to contact me either through WeChat or the mobile phone. Thank you for your question. Thank you for your question about the herbal medicine and its treatment of the COVID-19. For the patients of COVID-19, and mainly we treat them by the dialectical analysis of TCM. And mainly we think that the COVID-19 has a lot of moisture or the eczema in their body. But currently, we do not think one single medicine or herbal medicine going to treat such a patient. So we are going to have the combination of the herbal medicine of different kinds to treat the patients. And as for your question, we currently have no evidence for the effective of Himalaya herbal medicine, but still we think that they are going to be effective for the enhancement of the immunity. But currently, we don't think they are going to be used directly for the treatment of the COVID-19. Thank you for your question.
So if you have any question, you can just input in our chat box. Okay, I see that there's no more question. Then if you have any question after the class, you can just give it to the moderator, and the moderator would like to send it to the Dr. Xu, and he would like to respond to you. So if you have any question after the class, and if you have any interest, you can just send these questions within our group, and I would like to collect these questions and give it to the Dr. Xu, and also thanks Dr. Xu's sharing again, and also your answers. I would like to call it an end to today's session. And tomorrow we'd like to continue our classes. So see you tomorrow. Okay. And also thanks, Dr. Xu. Bye.